Good afternoon. My name is Lynn Liston. I'm the director of the Illinois Association for Infant Mental Health, Infant and Early Childhood Mental Health Credential System, and co-chair of the Workforce Development Committee.
Hello, my name is Laura Hansen. I'm the reflective consultant and coordinator for the Reflective Practice Group project, and I co-chair the Workforce Development Committee with Lynn.
We're so happy to be with you today to share the association's infant and early childhood mental health workforce system. We will show how diversity, equity, inclusion, belonging, and justice principles have always been a part of the Illinois system, and how we have strengthened and centered these principles in the current revision of our competencies. This is the most recent vision and mission statement of the association. The association is 42 years old. The leaders of the board began talking about infant mental health workforce development in the late 1990s and early 2000s with other leaders in the field who were developing competencies and systems of certification. Ultimately, the association made the decision to develop our own competencies and system to certify the workforce. The diversity-informed tenets for work with infants, children, and families is from the Irving Harris Foundation Professional Development Network Tenets Working Group. And they bridge and encompass all of our work. By centering the tenets in the intro to our revised competencies, we joined with others in our country who were demanding equity, social justice, and systems change.
Key to our workforce development process is that all credential and reflective practice groups are facilitated by seasoned practitioners who have been through our credential process and have experience facilitating small reflective groups. From the outset, the facilitators build relationships with the participants and work to establish a safe space for learning and reflection. Our workforce development system is broadly inclusive of practitioners from multiple disciplines who work in a variety of settings and in different roles. We find that bringing together a diverse mix of professionals allows for a very rich exchange of ideas, perspectives, and ways to approach our work. Finally, our comprehensive competencies build awareness and provide a framework for reflecting on myriad work situations.
Here you can see a side-by-side comparison of the credential groups and the reflective practice groups and see overlaps and differences. The main difference is a deeper examination of the competencies, 5 hours of reflective supervision, and a final case presentation to a panel at the conclusion in the credential. We developed the RPGs because credential applicants from some disciplines in some areas did not have the required reflective supervision hours and experience that is more typically present in social work, counseling, and psychology. We thought that the RPGs would offer a pathway to the credential and opportunities for applicants to experience reflective practice firsthand with a credential facilitator, meet with their peers, and use the 5 core competencies. We learned that while some RPG participants went on to directly apply for the next credential group, the RPGs served others, including those who had completed the credential with reflective practices they could not get elsewhere. Let's take a look at the core competencies. In the next few slides, we'll show how we conceptualize competencies and how they are intersecting and embedded with one another. We have reflective practices, self-knowledge, culture and diversity, contextual factors, family and community systems, infant-child development in the context of relationships, and professional ethics. This slide may be a little hard to read, but in the next few slides, we will pull out each core competency to better illustrate the intersections. This graph is positioned prominently in the introduction to the competencies. As you can see, this is bound by professional ethics. All 5 core competencies are embedded one in the other. They exist in dynamic and fluid tension with alternating ascendancy in any given context. Whatever the context, they occur simultaneously, a reflection of the complexity and originality of infant mental health work. Here we have the middle circle denoting 4 core competencies bound by professional ethics. This is the core competency self-knowledge. Here is culture and diversity. And finally, here's family and community systems. The next 2 slides illustrate sections from 2 of the core competencies. Both are interwoven with DEIBJ principles. You can see that we have moved from a circle graphic into this grid, which allows us to see the intersections of all 4 competencies, keeping in mind that everything we do is informed by professional ethics. This is 1.0, and this is 2.0. We want to bring some of these competencies and abstract ideas to life in a real case where all 5 core competencies were present and in play. In this example, Laura will present the story, and I will go back to the competency grids, and you can follow along and see what competencies Laura's using during that work.
A while back, I was an embedded infant mental health consultant in a community-based childcare center serving infants through kindergarten-aged children. The center was in a predominantly white middle-class suburb that included some low-income families and pockets of poverty. The self-awareness questions that I brought were, who am I? I'm a clinical social worker who's a middle-aged, middle-class white woman in a childcare center that serves low-income families. I'm a person of privilege. What do I bring? I bring experience, curiosity about the childcare program, the families, and the community. I bring humility, a professional sense of myself, engagement in regular reflective practice, and a commitment to professional ethics. The Child Care Center is run by a well-established statewide agency with roots in child welfare and a mission to serve and support lower-income families, including foster families and their children. Over 90% of the families in this program receive state child care subsidies. The families are diverse, white, Hispanic, African American, and mixed race, and include 2-parent and single-parent households. However, the staff is predominantly white and non-Spanish speaking. After working in this setting for a few weeks, I'm called into the Blue Room to observe Alberto, a 4.5-year-old boy in a Spanish-speaking immigrant family. He has 2 parents, an older brother, and a 5.5-year-old sister, Yasmin, who attends public kindergarten in the morning and is bused to the center for lunch and the afternoon program. The teachers in the Blue Room are overwhelmed by Alberto's dangerous and impulsive behavior. He is difficult to engage, tends to be isolated, and he persistently runs away and climbs on the tops of cabinets, scales the loft in the classroom, and had jumped the playground fence just a couple days ago and tried to run away. Fortunately, a teacher caught him. In this situation, because I was embedded, I had an opportunity to meet with Alberto's mother at pickup and actually make a home visit to see her interacting with her 3 children. My opportunity to be with the family at home, minus the dad, though I was holding him in mind, was important. In addition to my classroom observations, I met with the teachers many times and with the director. Fast forwarding a couple of months, the teachers noticed bruises on Alberto's abdomen and chest. Due to his bruises, we had to make a report to the Department of Children and Family Services, DCFS, which is Child Protective Services in Illinois. The director called Mom into the center, explained why we had to call, and this was handled in a very relationship-based way, with Mom present during the entire call. The DCFS investigator came the next day, and fortunately, the investigator was Spanish speaking. this is very important because this is a family that only spoke Spanish at home, even though moms could speak pretty fluent English, and so could Yasmin. But I want to just point out that Alberto understood English, but he didn't speak it in the classroom. The DCFS investigator learned that Dad had hit Alberto with a belt and threatened him and locked him into a crawl space by himself. About this. In their home. And Alberto was just totally terrified of being in the dark. And there were ants in the crawl space, which he called hormigas. And this was just so traumatic for him. This was a very awful experience for him. DCFS made a plan with the family, and Dad stopped his behavior, which diminished much of Alberto's stress. I partnered with Mom, with the program director and the public school, and we found a summer Spanish-speaking transitional kindergarten program for Alberto to attend, which required that Mom to be present and for her to take some hours off of work. This was 3 mornings a week for 5 weeks, and she arranged with her employer that she could take this time off to be with Alberto. I believe the special time that Alberto had with his mom was significant in his life and made a huge difference. The supportive relationships of his family and the community, the school and the child care center, eased Alberto's transition to kindergarten. We saw a really dramatic change in this child. He was able to become much more self-regulated, and he got on track developmentally in terms of learning and his social interactions. He was playing with other kids.
This was a very powerful story, Laura. And it was a case before you completed the credential and knew about the competencies. What skills were you using during the work? And now with the knowledge of the competencies, is there anything you would have done differently or thought more about more deeply?
Well, I was always holding and building relationships that was at the forefront of my work as a consultant. And my focus was on the relationships with the adults, with the teachers, the director, and Mom. And I was trying to hold in mind their unique perspectives, their roles and backgrounds. In retrospect, I really would have liked to have known more about the parents' own childhood. And I think the competencies made me especially aware of their immigrant experiences. Certainly I knew they were immigrants, but the competencies brought that up more clearly in my awareness. I also might have wanted to know more about their status in this country. Were they documented or undocumented? I don't believe they were citizens yet. And I wondered how their status as immigrants impacted their parenting of their children, especially the 2 younger ones. I mean, I could see when I did the home visit that Mom seemed more sure of herself with her older son, who was in school and involved with sports. She seemed much more relaxed with him than somehow with the 2 younger children. She just seemed more uncertain. And sometimes Yasmin, the 5.5-year-old, was kind of taking the little mommy role and kind of being directive and bossy with Alberto. So it was certainly aware that they were immigrants, as I said, but I think it would have been helpful for the teachers and the director and myself to have been more aware of possible implicit bias, and certainly the competencies really bring that to life in a more vivid way. That could have really contributed to our understanding of his family and their experiences better. For me, the competencies help us think with greater clarity and increased intentionality about the things that may be outside of our awareness.
Which is so important when you're holding all of the competencies in the middle of interacting with so many people.
Yes.
Well, we've reached the end of our presentation, and we realize that this is very complicated material. We hope that you will reach out to us with any questions. You can use our email addresses, which are here, or you can click on the QR codes. Thank you.
Thank you.